Our next new topic that we're going to cover is anatomical position, directions, and planes. There's actually more that goes along with this, but I'm going to break it down into smaller parts over a few days, so it's a little less for you to worry about at a time. This material we go over in Anatomy 1 and Anatomy 2. It's because it's used by medical professionals to give kind of a common understanding. So the language of anatomy itself, it's basically special terminology that's going to be used to prevent there from being misunderstandings. While, like, for example, if two doctors are communicating about a patient, it helps eliminate that possible, again, misunderstanding that could be there. We're going to use exact terminology for position, direction, regions, and structures. So first, we're going to talk about anatomical position. That's just a standard reference point that all other positions, movements, and planes are described in reference to. What anatomical position is when a person is standing erect or upright, palms are facing forward, and the feet are facing forward. So as you can see with the girl here in this picture, she would be standing in anatomical position. So all of our references when we're talking about directions or planes or just locations of different things, unless it's stated otherwise, you need to just assume that the person would be in an anatomical position. So whether they're actually in an anatomical position or not, that's how we're going to refer to different structures. So when you are looking at someone else, you're referring to all of these structures on the patient or on the person, not your own reference points. So right and left are going to be opposite. So if we were, you're looking at the screen right now, and this side would be your right, this side would be your left. However, the patient here is facing us, so this, which is on our right, is actually her left, and this would be her right. So you're going to need to keep that in mind, that right and left are kind of switched. But again, with anatomical position, the person would be standing upright, palms and feet would be facing forward. Okay. If we look at anatomical direction, so there are several directions, and we're always going to use the directions in comparison. So you're always comparing the relative location of two structures compared to each other. So an example that I have here written for you would be that the lungs, which would be in the thoracic cavity up here, are superior to the hips, which would be here. And if you look at this picture, we'll talk about superior on the next slide, but superior, it shows you as pointing upward. So that means that superior is closer to the head than something else. So in this case, the lungs are closer to the head than the hips would be. Okay. You have a box here on your notes that should look the same to try to give your own example. So right now, just try to pick two structures and using a term on this image here on the slide, try to come up with your own example. Okay. While you're doing that, I'm just going to continue talking. So you're going to need to type an example in. For now, it's okay if your example's wrong because we haven't gone over what these terms mean yet. So what I do want to point out is that you're always comparing two structures. So you're not going to just say that the lungs are superior. You need to say that they're superior to something else. Because if you just say the lungs are superior, it's like, well, they're superior to what? You're not comparing them to anything. So all of these directions that we're going to go over will be in comparison to one another. If you still haven't come up with an example, you can pause the lesson here. And then when you type in an example, you can just go ahead and click play again. So our first direction terms or pairing of terms that we're going to go over will be superior and inferior. The terms we're going over are all grouped with their opposites. So superior and inferior are opposites. Superior means that a structure is closer to the head or higher up on the body than another body structure. Another synonym that you may see occasionally that means the same as superior would be the term cephalic. On your notes, you've got a spot here to come up with an example for superior. Okay, so choose one body part that is higher up or closer to the head on the body than another, and say the blank is superior to the blank. That's how you'll fill in your example for superior. Again, as you're coming along where you need to fill in examples, you can pause the video and then continue up when you've typed in your example. The opposite, again, of superior is inferior. And if superior means a structure is closer to the head, then that means inferior is going to be closer to the feet or lower on the body than something else. A synonym for inferior is caudal. That's going to be used more, as well as cephalic, for animals that would have tails. Caudal refers to closer to the tail. So when we do our big dissection later in the year, we'll probably see that term again. So I just wanted to introduce that here for you now. There's also a spot for you to come up with an example for inferior. So I'm just going to go back for 1 second. On our previous slide, we had the lungs are superior to the hips. Okay. I do not want to see that same example here for superior. So I want you to try to come up with your own. And then because they're opposite, technically you could just flip-flop what you have. So if I had, for my example that I gave you on the last slide, the lungs are superior to the hips, you could flip that around and say the hips are inferior to the lungs. I want you to have different examples here. So your example should have two body parts here, the one being superior to the other, and two different body parts here, one being inferior to the other. And it's going to be that way all the way through. So for you to get full credit for your notes, I'm just going to say it once now, that you need to make sure that you're having different body parts for each example all the way through. Okay. If you have questions about how to come up with an example, just send me a message or come to a Zoom session and I can help you do that. If you need more time to come up with your examples, just pause the video here. If not, we're going to go on to our next term, or pair of terms, I should say, which are anterior and posterior. Anterior refers to a structure being in front of, or more close to the front of the body than another. So you need to have an example for that. And then posterior would be a structure being more behind or closer to the back of the body than something else. Again, you need an example. I will give you an example for anterior here. If you want to use it in your notes, that's fine. So you could say that the navel or the belly button is anterior to the stomach. Okay, it's closer to the front of the body than your stomach is what that means. Okay, so again, you need an example for anterior and posterior. Next, we have ventral and dorsal. So ventral means the same thing pretty much as anterior, and dorsal means pretty much the same thing as posterior that we just went over on the last slide. I would like you to come up with other examples though. So ventral, again, something being more in front of another body structure, and then dorsal being more behind another body structure. If you think of a dorsal fin on a dolphin or a shark, that's this fin that's right up here on their back. So that should hopefully help you remember that. You can use this diagram to help you with your examples. So you have the dorsal body cavity and the ventral body cavity. We'll get into that in one of our future lessons. But so you have the spinal cavity is dorsal to the thoracic cavity. How you could use that as an example there. You can also use anterior and posterior if you still need to go back and get examples for those. This diagram here can help you with that as well. Our next pairing of opposite terms is medial and lateral. If you think of medial like middle, medial refers to a structure being closer to the midline of the body than another structure. So the midline of the body would just divide the body into even, or as close to even, right and left portions as possible. So going right down the center of the body would be the midline. A structure being closer to the midline of the body would be medial. The opposite would be further from the midline, and that is lateral. So lateral refers to the sides or further from the middle. You're going to need to have examples for each of those. Our next pairing of opposite terms seem to give people the most trouble. and they are proximal and distal. So I'm going to spend a little bit longer time talking about them than the other ones. So proximal and distal, I have this note here for you that they are only used for the limbs. So you can only use them for structures on an arm or on a leg. So you would never use proximal or distal to talk about a structure on an arm and a leg, or on opposite arms, for example, or opposite legs. It would need to be on the same arm or on the same leg. So proximal just means that a structure is closer to what we call the root of the limb than another structure on the same limb. So the root for the arm would just be the shoulder. So where that limb attaches to the rest of the body. So the shoulder. For your legs, the root would be the hip. Okay. So for example, you have, let's say we have your elbow and your wrist. Okay. Your elbow is closer to your shoulder than your wrist is. So you would say your elbow is proximal to your wrist. Okay, that means, again, your elbow is closer to the shoulder than your wrist is. So it makes sense when you think about it in kind of common language. So you just need to put those terms into that example. So probably the easiest way to come up with your examples, and I should have, I guess, gone over this earlier, is to think of how two body parts relate to each other in their location, and then fit that into the terms. Okay, so proximal is closer to the root than something else. So if we think about on a leg, the toes are farther away from the hip than, well, really anything else on the leg. So you could say that, if we're going to go for distal now, the toes are distal to the ankle, or the toes are distal to the shin or the calf or the knee or the thigh. That would mean that the toes are further from the hip than any of those other structures. And you are welcome to use those examples on your notes if you would like to. Next, we have superficial and deep. So superficial means that it's closer to the surface of the body than another body structure. The opposite, deep, would be closer to the core of the body than another structure. An easy one to use for superficial would be the skin, because it's the outer layer. So if you want to use the skin in your example, the skin is superficial to blank. You can fill that in for yourself. You also need an example for deep, closer to the core of the body than another structure. Next we have, and I'm not having you do examples for these because these are just body positions. Prone would be lying face down, or basically on your stomach. Supine is laying face up. Those we won't really use too much of, but we do need to go over them now. So again, just face down or laying kind of on the stomach, the ventral side of your body would be prone. Laying on the dorsal side of your body, face up, would be supine. Next, we have unilateral and bilateral. So those prefixes, uni means one and bi means two. So if something is unilateral, then it is pertaining to just one side of the body. And if it is pertaining to both sides of the body, it would be bilateral. So maybe a person has pain in both of their knees, we'll say. You could say that that person has bilateral knee pain. That would tell the doctor that they would have pain in both knees. If they had unilateral right knee pain, that would mean that there's pain only in their right knee and not their left. Okay. So the examples for unilateral and bilateral are going to be a little different than the other ones, because you're not using them really to refer to where two things are located to on the body. It's just, is it on one side or both sides? So keep that in mind when you do your examples. Okay, that's it for our directions. The last thing we're going to talk about today are anatomical planes. These are just fixed reference lines where we would normally divide the body into different sections that allows different structures in the body to be viewed. It lets us see things in a three-dimensional perspective. What we have here are different MRI images. So this would be from the side view, and then here would be kind of if you looked like across this way into the head. So it's the head on both of these. Like when you see little circles there come up, those would be the eyes. So it's kind of going, looking like through the head that way. And then this one would be looking through the head that way. Okay, so it just gives you different views and reference points. So the first plane is the sagittal plane. So sagittal, if you think side to side, okay. Sagittal divides the body into right and left portions, not necessarily equally. So anywhere from left to right would be sagittal. If it is exactly down the middle, into equal right and left portions. So the body isn't perfectly symmetrical, outside or inside. So when we're saying equal right and left, it's not really equal, but right down the center of the body. So mid sagittal, sagittal again is side to side, mid think middle. Mid sagittal is specifically down the middle of the body. Next we have the frontal or coronal plane, and that's going to divide the body into front and back portions. So you can see here, you could see kind of like through the body from the ventral side back towards the dorsal side. And then the last plane we have is called either transverse or horizontal, and that divides the body into upper and lower portions. Now for that, you weren't doing examples or anything on your notes, but what you do have is one last thing, and it looks like this. I'm going to leave you to do that on your own. You can refer back to those diagrams on the previous slides that you have in your notes. But what you're going to do is you have the four planes we just talked about, and you're going to need to move them onto the diagram so you can see that you can click and drag them. Okay. You're going to move them onto this diagram. Now there are only 3 numbers and there are 4 terms. So one of these numbers is going to get 2 of those terms next to it. Okay. If you have questions about any of the directions that we went over today or the planes that we talked about, you can reach out and let me know, send me a message, come to a Zoom session, and I can go over more examples with you. I'd be more than happy to do that. Once you're done and you submit your notes, you're going to have a couple things to practice today, just using the information that we talked about today. So you'll make sure you submit your notes and make sure you submit the practice assignment, and that will be it for today. Have a great day.